Hi guys, from Maryland. So we're going to talk about spine surgery and neurosurgery. And obviously spine surgery is part of neurosurgery, but some of the instrumentation is going to be very similar to the orthopedic back instruments that we just looked at. We looked at Carrison rongeurs, we looked at regular rongeurs, we looked at curettes, we looked at osteotomes, elevators, drills. Those kinds of things are also going to be used on neurobacks. Okay, you just have to realize that they are different in that the neurosurgeon, of course, is more focused on nerves and so forth. Okay, and they're working on taking out vertebrae, and orthopedics surgeons are also doing similar things, but their focus is a little different. So just know that the instrumentation is similar. Where the neurosurgery takes off on its own direction is in, of course, as working in the brain. So obviously you're going to be taking, you're going to be having access to the brain, meaning you're going to do a tissue flap that you're going to wrap in a lap sponge to keep moist. You're going to enter the brain using a craniotome with a burr hole tool. When they make the burr holes, they're going to now connect the burr holes with another attachment with a little foot on it that kind of sails right underneath the skull, and they're going to collect those, take that bone flap out, and they're going to put that, you're going to keep that on the back table and keep that moist so that they can put that back when the surgery is done. Obviously the reason for entering the brain is going to be cancers, aneurysms, arteriovenous malformations. So hematoma evacuations, of course, depending on what it is that you're doing, is going to determine how long you're going to be there, how deep into the brain that you need to go. There's shunt placements that have to be done as well to drain cerebrospinal fluid. So please be aware of the different layers of the brain, the dura mater, pia mater, and the arachnoid mater, so you know where these different types of epidural or subdural hematomas are forming. Make sure that you're aware of the circulatory system in the brain. The circle of Willis is our area of most import, where a lot of the Berry aneurysms and the arteriovenous fistulas form. Okay. When you talk about brain surgeries, we're sometimes doing the stereotactic type of brain operations, and this is a measurement device where they can map where they want a particular electrode to go, and this is going to be a lot of times for those types of procedures where the person has chronic pain and they're putting an electrode in to create the white noise so that there's distraction. The patient doesn't feel pain anymore, but they feel, say, a buzzing or a different type of energy that takes the mind or that masks the pain. Okay. The sponges that are used during neurosurgery are the cottonoids. Instead of using, use Ratex sometimes, but for the most part, for brain, you're going to use your cottonoids, and they come half by half, 1 by 1, 2 by 2, half by 1, 1 by 3. They come in lots of different sizes, and they usually come in little packets of 10, and you have to really keep track of them because they're very small and they get very bloody sometimes. You're going to be using bone wax, which is also used to control the bleeding on the bone edges, and Surgicel, which is a methylcellulose type of material that is also forms clotting, helps with the clotting factors. Okay, you're going to use your bipolar forceps, which is was bipolar, so that you don't have to use a ground for it. The action is right between the tips, so you bzz the different blood vessels. Okay, and they're very sharp, and they're usually bayonet forceps. So you're going to use your bipolar, and you're going to use your suction, your Fraser suctions, and they're usually going to be very fine. There's, they come 3, 5, 7, and then sometimes depending on what you're doing, you might use the bigger ones, 12, 14. It just depends, and you have to make sure that you have at more than one of each size, and that you are able to keep it clean either with the stylet or with some irrigation to keep the suction open. Okay. You want to make sure that there's some things that you never want to use on the brain. You never want to use methylene blue on the brain because it causes an inflammatory reaction. You never want to use antibiotic solutions because they're caustic to the delicate brain tissues. Okay. When you're positioning spines, you're going to be using your Wilson frames, and there are several different types of Wilson frames that you may be using. Just be familiar with the ones in your institution. You're going to be using different types of head holders for the craniotomies. You're going to be using the Mayfield head holders, and they generally use pins that are sterile, that are placed in the head holder, and you put betadine or something on there, and then they're hooked into the skull for that placement. Or there's sometimes the horseshoe head holders that can be used. But remember, as that person is laying in that dependent position, very frequently they're going to have a lot of facial swelling. Okay? And make sure, again, as you're positioning them in their position, that you're making sure that their chest rolls are in proper alignment, and that their genitalia are unencumbered. Okay? Let me think what else. Make sure that when you're passing instruments to the neurosurgeon, that you are passing them correctly and in the right orientation, so that the surgeon does not have to lift up their head to look at you because you gave them something incorrectly. So be aware of how you're handing those instruments, so that you're handing them in the position that they're to be used, so the surgeon does not have to look up. You're going to be using microscopes. You're going to be using different types of ultrasonic type of equipment to suck out brain tissue, the cavitrons and those kinds of things. Make sure that those things are not falling on the ground, that they're not dragging, falling off the field. Okay, so you're going to have a lot of long tubings and things. Make sure that you have a good handle on securing those things. You put in shunts sometimes that go down into the peritoneum, and that's going to be going into the brain ventricle. Just know how to put those things together. That's when you use your little tiny Allen wrenches, right? Remember the ones that we saw on the instrument table. So go ahead and do your reading, and I'll see you next time.